Nice to meet you. This is Mr. Panda, show you an unexpected China. Today we're going to talk about how Chinese control COVID-19 in 2021. The theory Chinese use is quite simple. As long as the people have no access to the virus, it's impossible for them to get infected. I'm going to show you how Chinese carry out this theory in detail from a perspective of an ordinary person in China. The key is to stop people carrying virus to other places.
The hard part is that nobody can tell if the man gets on the train is carrying the virus or not immediately, even the man himself. How can we stop people carrying the virus to other regions? We create a kind of QR code called house code. The code is bonded with my ID and it tells others the probability that I am carrying the coronavirus. Initially, the code is green. It turns yellow or red when I am likely to carry the virus. There are volunteers everywhere. They record my travel routine by scanning my house code. If someone in my community is proved being infected, the district I live in would be regarded as medium risk area, and the residents may have yellow health codes. If the number of the new cases breaks 50, that district would update as high risk area and the residents may have red health codes. When someone I stayed close to get infected, my house code would turn red too, if the last close contact happened in 2 weeks. They cannot travel to other districts. People who have yellow code mustn't go to anywhere unless they are going to the hospital or their communities. People who have red code must stay at home or hospital. Without showing any symptoms for 2 weeks or 4 weeks after recovery, the house code would turn green automatically.
Is this solution effective? Let's have a look at the coronavirus trend in China.
Here's the coronavirus trend in mainland China. The number of new cases dropped below 100 in May 2020, that is 6 months ago. Let's see the number of new cases in 30 days. There is a small outbreak in northeast China 1 month ago. We are going through a national travel rush to celebrate the Chinese New Year. The number of new cases rose over 100 on the 10th of January 2021. However, it goes down to 25 in 3 weeks. From the information I've shared with you, you can see that a small coronavirus outbreak is neither avoidable nor predictable, even if we have succeeded in controlling the virus 6 months ago. But there is still a way that we can lower the number of new cases after realizing that there is an outbreak. We can achieve this by dropping the probability of healthy people getting infected.
To maintain the number of daily new cases below 100, how much freedom are people sacrificing? Let's see how the COVID-19 prevent practice affect the life of ordinary people in China.
Before going out, I must prepare 2 things, my mask and my phone. The mask and the house code work as gate pass nowadays. If I don't have a mask or a code, I cannot go anywhere. There are volunteers checking these things everywhere. Malls, stations, airports, anywhere you can imagine. In some place, for example, stations, have thermal imagers to check people's body temperature. Anyone who have an abnormal body temperature, his or her health code would turn red until he or she is proved not being infected by coronavirus. We avoid being infected in many ways. When in the left, we use cotton swabs to press the buttons. Some of the public relaxing areas are now restricted. People avoid eating at public. Many restaurants go bankrupt.
What's the practice to prevent COVID in your region? Do you think it is necessary? Share your experience with us by leaving a comment. Now back to the topic. Though the pandemic is under control by the practice, a few people refuse to obey the orders, refuse to show health code, refuse to stay at home when their codes turn red, even attack the volunteers at the entrance. In Harbin, one volunteer was stabbed to death by an unreasonable man. This makes people wonder the necessity of the practice to prevent COVID. The truth is, the medical system in China can only deal with a local pandemic outbreak. 1 or 2 provinces are the most.
I learned the ability of the medical system in China from a report published by The Lancet. The author evaluates the healthcare access and quality in different regions. The China the author described is close to my personal experience. If you want to know more about this article, you can find it by this DOI number. Before we read this chart, we should know that the HAQ index is the abbreviation for Healthcare Access and Quality Index. If a region is blue, it has a higher HAQ index. Vice versa. As we can see, the medical resource distribution in China is lopsided. Apparently, people live along the coast have the most abundant medical resource with the highest quality. The HAQ index in the Midwest is lower than the East. I'll share my experience seeing a doctor in different regions in China in another video. From this table, we can see that mainland China ranked the 48th in the world. Its HAQ index is 78 on average. According to my personal experience, the hospital is crowded with people all the time literally. On average, doctors in China work 51 hours every week. According to a survey in 2018, their work has been already overwhelming long before the coronavirus outbreak. Metaphorically speaking, we can only defeat the baby Thanos. Once he has grown up, we have no chance to win him. In another word, we can't handle a national pandemic outbreak, but we can control a small one.
That's all for today. I hope my videos can be useful. Next video will introduce facts about vaccine in China. What do you want to know about China? Let me know that by leaving me a comment. I will make videos for you. If you enjoyed this video, don't forget to subscribe and click the little bell on the bottom of the screen. Bye!